Hi there, my name is Ariana Mastro-Leonardo, and today I'll be speaking about my BASIS study, determining the knowledge, attitudes, and practices of secondary school students in Ontario towards the COVID-19 pandemic. The world as we know it has been flipped upside down. Countries have gone into lockdown, jobs have been lost, online platforms like Zoom have taken over, schools have moved online, mental health has become increasingly unstable, and people have been told to not do the thing that they do best: socialize and connect in person. While this has impacted people of all ages, it has had an enormous effect on adolescents, who are amongst the biggest spreaders of this virus. The adolescent population must be studied more in depth, which is why a Knowledge, Attitudes and Practices, or a KAP, assessment was done on secondary school students in Ontario towards the COVID-19 pandemic. This was done to gather information to be used in preventing the spread of COVID-19. Once research was conducted, it was hypothesized that of the teenage students tested, the older students would have a better knowledge of COVID-19 when compared to the younger students, as they had more educational experience. It was also hypothesized that students with a higher knowledge of COVID-19 would have a better attitude, and their behaviors would be more in line with preventing the spread of this disease. This hypothesis was supported by the fact that a greater knowledge and understanding often leads to the associated favorable thoughts and behaviors. To test these hypotheses, a survey was developed and disseminated to students across the province. A total of 273 students participated in the study. To analyze the data, first, an overall knowledge score was calculated and a bar graph was made to compare the knowledge score of younger and older students. Then, histograms were made to illustrate participants' responses to the attitudes and practices questions. Finally, linear regressions were calculated to correlate the relationship between knowledge scores and attitudes and practices. There were many interesting findings. In terms of adolescents' knowledge of COVID-19, it was found that the older group did indeed have a higher knowledge score than the younger group, which supported the first hypothesis. But it should be noted that an overall knowledge score of 59% accurate across all participants is not very high, and it suggests that adolescents do not have a comprehensive understanding of COVID-19. The survey also asked students about their understanding of government restrictions around the pandemic. Quite alarming was that 58% of students reported being sometimes, often, or always confused. Only 41% reported being never or rarely confused by the restrictions. This would suggest that not only knowledge of COVID-19 is not great, but that knowledge and understanding of government restrictions is also not the best. In looking at the students' attitudes and practices, it was found that most students follow the rules around things like wearing masks in public, hand washing, and following their school's pandemic rules. In regards to social practices, most of the students, 64% of them, are following social distancing protocols. More of a concern is approximately 35% are not following the recommendations around social practices. In looking at the relationship between knowledge, attitudes, and practices, there were no significant correlations found. So these findings suggest that while most students were following the rules, it's not dependent on their knowledge of COVID-19. These findings can be explained in looking at the blind obedience to authority phenomenon, which is when people do as they are told without truly understanding or thinking about what they are doing and why they are doing it. For example, 81% of students responded that they are often or always following their school's pandemic-related rules, even if their knowledge was not strong. This shows the power that schools have over students' behaviors and the authority they have in influencing a student's practices. As Ontario begins its policy of vaccinating its population, findings from this study showed that only 59% of students were likely to take the vaccine. This is despite the fact that the majority of students surveyed believe in the efficacy of vaccines more generally. This might suggest that students do not fully appreciate the importance of the COVID-19 vaccination for reducing the severity of symptoms in those who get it and in ending the pandemic. There are a number of applications from this study. As a start, secondary school students in Ontario clearly need a greater understanding of COVID-19 and the government restrictions around slowing its spread. Perhaps governments and schools could work together to distribute the information, including putting it on highly accessible social media platforms. Further, to better engage students and provide accurate information, it might be helpful to consider pairing medical specialists with adolescent influencers to spread this knowledge and information. There are a number of areas of future research to be considered. First, as participants in the study were primarily from southwestern Ontario, it will be essential to broaden the scope of participants, including gathering data from students in other areas of the province, such as areas that were harder hit by COVID-19. Such a study could also be extended to a global population of adolescents in looking at the knowledge, attitudes, and practices of students living in different geopolitical and socioeconomic communities to discover if there is a correlation between the rate of COVID-19 infection and the K8P values. Thank you for listening to this presentation. I hope you enjoyed hearing about this study. I certainly found it fascinating and a very timely topic to investigate. Thank you also to the organizers and sponsors of BASIF for providing us students with the opportunity to participate in the science fair once again this year, despite the unusual circumstances we find ourselves in. Finally, I cannot finish this speech without acknowledging the role of my chemistry teacher, Dr. Kahama, as well as my older brother and mom, who have played a major role in inspiring me to pursue scientific endeavors. Thank you.